Hoot is a creative health organisation working within mental health specifically. We deliver creative activities and workshop programmes across Kirklees. The main commission service is called Out of the Blue, and that's for people 18 and over.
I'm committed to enabling the investment in creative arts because we know the benefits that it helps people with. It's not all about a clinical service or an intervention. This is about the rest of their life. It's about, people enabling themselves to be themselves.
This current council and NHS commission, which is for the Out of the Blue service, was commissioned about 5 rounds of commissioning ago. So 20 odd years ago, it was still really early days and there was a lot of risk aversion around it. That evidence base that was built up, which I think is what's allowed the commissioners locally here to be informed enough to make that decision to commission an organisation like Hoot.
When people are given a diagnosis of mental health, some people accept that diagnosis and are reassured. Other people, it can be devastating. This is about working with them to ensure that they've got anchor points in their life. It's about other aspects of their life, so social interaction, expressing themselves and trying to tease the person back out of the person who's now got a label.
You say creative arts, and back in the day I might have thought, sitting and doing a bit of painting, it's far wider than that. Think about how wide and how versatile we can be with creative arts. Everybody has a bit of creativity in them somewhere, and it's a good way to engage with people. It's well documented how creative arts do help. It's the outcomes of people that really matter.
The impacts that I see on participants here at Hoot are numerous. You hear laughter and chatter and wonderful singing, and you see people fully engaged. There's a lot of work involved in assessing risk, checking what the levels of mental health needs are within referrals that are coming through. We're seeing a real rise in the complexity and the levels of mental health problems that people are experiencing. So we have to hold that space and allow that flow state to be reached. It takes a lot of careful management, and those referral processes take a lot of time and effort.
I think it's important to not tout creativity as a cure-all, but there's been quite a few times where people have told us how being creative in the groups has saved their life, and I genuinely believe that. Yeah, when someone tells you that, it's a really powerful thing, and it's great if people don't have to then go and access other services and things like that, but for them to still be here and contributing to the world is really special.